Welcome back. You're watching NewsNight Nigeria here on Arise News. I am Amaka Uday in the nation's capital, Abuja. And my guest tonight is a man leading the war against COVID-19. Well, Nigeria's Minister of Health, Dr. Osagie Ehanire, joins me now in the studio. Thank you so much, Dr. Ehanire, for being here in the studio with me tonight. And of course, a good place to start this conversation today is the fact that the President has announced a gradual easing off of the lockdown starting on Monday, the 4th of May. And there's been a lot of arguments, really, in terms of the health and the economy and the reason why we're seeing this. And Nigerians are wondering, are we jeopardizing the health of the people for economic consideration at this point?
Well, it's a difficult decision. You have to walk a thin line between what you call jeopardizing the health, which may not necessarily be that, and also the livelihood of Nigerians. As you know, a lockdown has a devastating effect on the economy, on social life, and on the livelihood of many people. There are lots of results of the effects of this lockdown that are not too good. So you have to take a very difficult decision indeed between what to do to get continue to get the health side of it right, and also to try to ease the economy so that people can make a livelihood that they are used to. We do not have the very social structure of other countries who are able to take care of all citizens in such a difficult emergency. We're not structured that way. So it is a difficult decision, and I think the right decision has been taken by the President to ease the economy a little bit, and at the same time put a very strong searchlight on the health side.
And of course, this raises the question of the next phase that we're in right now as it concerns community spread, which you yourself, during the daily briefing, you've talked about it really. And of course, one other area that you've talked on is the non-essential travel. It's a key issue that the President equally spoke about during his address. And talk to us why it's important that people stay put, especially as we're entering a new phase, seeing all of this community spread across the country.
Yes, you're correct. And that is one of the spin-offs that we have to follow up when you ease the restrictions in the country. We know that the virus has to be transported from one place to the other, and they are transported by persons. Not by other vectors like we have mosquitoes or rats, but these are transported by persons who might have the symptoms or might not have the symptoms, and when they move from one place to another, they carry it with them and share the virus and infect other people. So restrictions in travel are extremely important, and part of what we have to really work hard on is restricting these movements so as not to carry the virus all over to places where they don't need to be. The infection as a whole came into this country by air travel, and now it is being transported mostly by land travel, because air travel has been stopped and rail travel has stopped. So we are urging citizens to stay where they are unless the movement is absolutely essential.
Right. And so what are some of the constraints that we're faced with right now as we try to test more, especially to stem the tide of community spread?
Well, some of the constraints we face right now are the tracing of the contacts and the cluster areas, and being able to get the tests done, the samples taken, and sent to the laboratories. There are some delays in getting the tests done or getting the samples to the laboratory, and also in the long line of tests that need to be done. Despite the fact that 15 laboratories are working, the logistics around the use of all of them still need to improve. It will need to get better because the utilization of our laboratory capacity at the moment is just about 50 or 60%. And we need to improve on the courier and delivery service to send samples to where they should be tested.
Right, and of course, while we're talking about testing and all of that, we have to also look at the capacity of the personnel involved in this fight, from the frontline workers and even to the courier men out there who carry the samples from one state to another. Do we have enough personnel? Are they adequate, especially looking at the population of Nigeria and the hard-to-reach areas, really?
Well, we hope and pray that this virus doesn't get to hard-to-reach areas. Not yet, because it has to be carried by people, and if the people generally are in the cities or in the main main population areas, we track them down there and find them, so that we do not have to worry too much about the areas where the population might be scarce and difficult to reach. So the contact tracing does have to be very efficient. You need to be able to follow the trail and be able to get to where you suspect that the cases will lead you, and also look for symptoms, look for the possibility of those who are still contacts of travelers, or those who have come from countries either by land border, because there is also some suspicion that there are cases coming in from Niger Republic or from Cameroon or from Benin, from our neighbors generally, who are not very well monitored, because of the way the borders are watched, overseen. So the concerns are many in that respect, but we have no choice but to increase the testing capacity, and it was announced today that we want to ramp up the testing capacity up by within 3 months to a good number that will cover what we want to be able to be comfortable with.
When we're ramping up our testing capacity, which of course just yesterday was announced that the Rush machine, which gives us the capacity to test up to 1,000 samples at the same time. But the question I asked you really, do we have enough adequate workers in the front lines, ensuring that from the testing to even, taking care of those in the hospitals, and do we have enough right now working in Nigeria?
There is training going on. People are being recruited and trained, and today I also urge the Director General of NCDC to come into the Ministry of Health and source for personnel there to help. But I don't think that the shortage is such that it hinders the sample collection. I think it's just a strategy that needs to be ramped up, and when it's ramped up, they will be able to recruit the personnel they need to fit this strategy that they are going to be we are going to use in the coming weeks.
Okay, so now let's talk about the search for vaccines. Globally, of course, we're seeing research all across the world, from different parts of the globe. Nigeria, where are we in terms of searching for the solution to coronavirus in the country?
Well, everybody is searching for a solution. Everybody is looking, all countries are looking for ways to find the answer to the problem. Nigeria is not left out. We are encouraging our research agents, the Institute of Medical Research in Lagos, the NCDC itself, Primary Healthcare, NIPRID, that's the Institute for Pharmaceutical Research and Development, to come together. This evening I in fact signed a memo asking that they come together and make a proposal for common strategy to push research from our side here. We have also been looking at convalescent serum, that is to say serum collected from those who have recovered, to see how it can be used in treating really acute cases. If the cases are so severe, we know that there is no really reliable medication yet, so we're looking at the possibility of using convalescent serum to treat those whose conditions might be very serious.
Well, while it's laudable that, as you've spoken about the fact that, from the government side, there is a memorandum of understanding that was signed today, but I'm concerned about the local researchers, really. How much progress have they made, and how much support are you really giving to them to ensure that they push for a vaccine to come out of Nigeria?
We are giving them all the support. Remember that the Nigeria Institute of Medical Research successfully did the genomic sequencing of the coronavirus some time ago. So that is one big step forward, and they were the first in Africa to do it. And the Lagos team was also already active in collecting convalescent serum. So when they put forward proposals, we shall support the proposals. There is a research grant that will be developed, and that will be brought forward.
Developed when? This fight has been on since the beginning of the year.
Well, it's been
this
on
is 4
since,
months in.
Oh, it's 3 months and some weeks in, and we're beginning just to understand the nature of this virus. Remember, it's a new virus. Everybody is trying to understand it. Now, research is not something that works overnight. It takes a lot of study. You have to have a lot of experiments, a lot of conversations. You also compare notes. Scientists compare notes. You watch where other countries are. So it is going on, and even highly developed countries who have a very good track record for finding solutions, have not yet found one that is reliable. We hear that in the UK they are also going to try convalescent serum. So we're not that far behind other countries, really. We might not be at the very top, but we are not far behind other countries, and everybody is like still groping in the dark as far as coronavirus research is concerned.
We'll come back to research, really, but let's talk about another issue now, which is of the Chinese doctors that came into the country some 2 weeks plus ago. Of course, today at the briefing, you did make mention of the fact that they've had tests done on them, and this test came out negative. What next is the question. So what are they supposed to do here in the country beyond, you know, the CCECC construction company workers that you're supposed to see?
Well, they come in as visitors, or as, I don't know how they came in, but they are with CCECC, and they were quarantined for 14 days. And we conducted a test that showed they're negative, and the Ministry of Health is done with that.
Okay. So what happens next is my question. Are you planning to work with these doctors? Talking about you now, the Ministry of Health, as it concerns our fight against coronavirus, or they're just supposed to treat
in the first place,
or talk to those at the CCECC and go back to their country
in
from
the first
there?
place, I do not think they're all doctors. I'm not sure they are all doctors. I'm sure there are technicians and so on among them. But just a few days ago, we had a teleconference, video conference with China, experts of China who engaged African countries in sharing their own practices and sharing their own challenges and sharing knowledge. So those, it was very enlightening for us, talking Chinese scientists all the way from their country here. But as for the ones who are here, I cannot tell you what becomes of them. They are not really guests of Federal Ministry of Health. So we.
But don't you think this is an opportunity to tap into their wealth of knowledge as to how they contained it in their country? Yeah,
correct. It is, and we have actually had a conference with those, some of them who have participated in their own country's response. A video conference on one occasion in which staff at the Ministry of Health were able to ask questions and get some knowledge out of them. I didn't attend that particular day because I was at another meeting, but I'm told that it went very well. They did get some knowledge from them.
All right, Dr. Osagie Ehanire, you're still with me in the studio, but time now for a quick break. When we return, we'll discuss healthcare workers' welfare, as well as the unexplained debt coming out of Kano and more. Do stay with us. Welcome back. This is NewsNight Nigeria, coming to you live from the Nigerian capital, Abuja. My name is Amaka Ude, and I've been speaking with the Minister of Health, Dr. Osagie Ehanire, who is the man who is, you know, the forefront of the fight against COVID-19 in the country. Thank you so much for being so patient and, of course, giving us answers to all of these questions that Nigerians have as it concerns their health and the general fight against COVID-19. Thank you again. And, of course, before we went on that break, we were talking about the Chinese expert who came into the country some time ago. Yes, you've told us that there was a meeting between your ministry and, of course, this expert, but you were not there. But can you talk to us about some of the things we've learned from them, especially how they were able to contain the virus in Wuhan province?
The Chinese are a very organized society, and they were very firm in their lockdown of their city. They were able to have a mechanism for supplying their people, and also very strict in putting everyone who tested positive into isolation. And we learned about the mechanism by which they conducted their treatment. You know that they built a hospital, I think 1,000 beds in 10 days or something like that, which was to ensure full and complete isolation of those who tested. So the learnings from them and from the way they handled intensive care is what really enriched us here in Nigeria from point of view of how they dealt with coronavirus.
Intensive care, really. Now, let's talk about the fact that when this pandemic first started, the use of face mask was, you know, some sort of controversy where some quarters believed there was a need for Nigerians to wear the face mask, but some others said, you know, there was no point. But now it has now been made compulsory in the country to wear the face mask. So talk to us about what informed that decision of Mr. President announcing that Nigerians, if you have to step out of your house, you have to put one on.
Okay, now the mask is an additional precaution that you take. When you have the relaxation of the lockdown that the president has announced and restricting interstate travel, but relaxing intrastate, that is to say moving within the state, there is a more likelihood of people running into gatherings of people, running into persons who might be positive. So a mask will help you. So if there is a mutual wearing of masks, two people wear a mask, the risk of unintended or unknown transmission of infection between the two is greatly reduced. So that's one reason. The other reason is that it is clearly impracticable now that we know that this virus has moved into the community transmission phase. It is impracticable to always expect sufficient social distancing. It goes into communities where there are several people sharing one room, where there are many people who live in communities, where the kind of social distancing that we have between us now will not be practicable. Therefore, if they are able to protect themselves with an extra layer of something like a mask, or it might be a veil, or something you wear to cover your face, or it might be a handkerchief, or it might be your scarf, then you reduce the possibility of droplets or aerosol from one person getting to another. So that will help to reduce the risk of transmission. That is why the mask becomes very useful, particularly in closed settings where you cannot be very sure that social distancing will work very well. But it must be emphasized that the mask wearing alone is not the only measure. It is just an additional layer, as I said. You still have to strive for the social distancing, to wash your hands regularly, not to touch your face unnecessarily, to use a sanitizer, to avoid crowds and gatherings, and spend most of your time inside the house.
Right, and of course, speaking about spending time inside the house, going with the president's broadcast, really, let's talk about the curfew from 8 p.m. to 6 a.m. What really informed that decision?
Well, what informs it is that there are people who, even if you told them not to move, if you had an interstate blockage, or let's say if you stopped interstate travel and also didn't allowed intrastate movement to continue, people will move around. But if you put in a curfew in the night, even within the cities, movement will stop. Interstate travel will also continue to be restricted, and persons who would like to seize the opportunity of darkness to sneak across state borders will find themselves in serious trouble, because it was a practice that even if you banned interstate travel, people thought, well, in the night nobody will see me if I try to sneak through. But a clear prohibition of nighttime movement means that you are going to be answerable to the law if you are found either on the highway or in the city at these times.
All right, so while we await the protocol as to how this will really work, let's talk about Kano State. Yesterday you announced that a 9-man delegation has been sent to the state to really find out the cause of the deaths there. But I do know that an investigation started way before they left for Kano State. Your preliminary investigation, what do you know about Kano and what is going on there?
Well, what we know about Kano so far is what we have heard by talking to the authorities in Kano. I have had a discussion with His Excellency the Governor, and what he and others have said is that actually the deaths there are not unusual. They were picked up and then
high
highlighted.
Numbers, almost 600 has been reported by national TV station there.
We do not know the exact figures yet, and what they said is that from the cemeteries and burial grounds, the numbers for the period were not unusual. That's what they said. But they are also looking into it to carry out more investigations, and the team we sent in there will also join in trying to do some fact-finding. You might, for example, want to know if the persons who passed away were all scattered all over, or they came from scattered places all over the local governments, or if they came from particular clusters. If they came from a cluster, let's say a whole family or a whole community, then they may have had an infection which was passed from one to the other, and that particular cluster would have had a high rate of deaths. But if they are just disseminated, scattered all over, then it is unlikely that it was caused by one agent going from place to place. But again, that will be the subject of interrogation. You might also want to find out, ask people what symptoms the sick people had before they died, and try and elucidate if they were in any way related or could have been related to COVID infection. Those are the kind of investigations they carry out. Those are experts who know how to.
So can you give us a time frame when this investigation will be done? Because I do know that testing was not done for about 5 days in Kano prior to the reopening of the lab that was shut down.
Yes, the lab was shut down for reasons that I believe are already well known. How long this investigation will take is not very clear. It depends on the speed with which they are able to interrogate, question people and witnesses. It also depends on how extensive they have to investigate, if they have to go further afield than we thought. So all those things matter a lot. The laboratory in Kano has been restarted, I believe, today because a new team was sent in there after it was shut down. Right.
Well, we'll wait for that investigation to be concluded so Nigerians get the answers to the questions as it concerns the number of people who have died, if it's COVID-19 related or not. So, by the way, congratulations to you and your team for securing the health insurance for the frontline workers, and also, you know, the hazard allowance, you know, improving. Congratulations, really. But before I let you go, to wrap this up, are there lessons we're learning from the COVID-19 fight that Nigerians can use in the future?
Well, we are learning lessons, and I believe the whole world is learning lessons. I do not think that there is any country who's not looking very closely, and we're all watching other countries. All countries are watching each other and looking at each other's strategy and seeing what works and what doesn't work, and who made a mistake, because some countries actually make a mistake with their strategy, who miscalculated, who did it right. And so we're all trying to learn lessons from each other. And here in Nigeria, we also learn lessons that at the end of the day, we are on our own, because many of our traditional friends have problems of their own which they're trying to look after. They are still reaching out to us very well, and we are realizing that we need to rediscover ourselves and be more self-reliant.
Right, but of course the health infrastructure of the country, you yourself, you've asserted to the fact that our health system is really poor. So at least with this pandemic, are we looking to improve on what we had prior to the pandemic, at least to make things better, so we're not seeing this health tourism that we usually see in the country?
That's correct. The need is there. We're discovering the need. And not only that, we're also discovering the urgency, because you discover that it is not very easy to jump on a plane now and go somewhere for treatment. This is the place. So the opportunity to take a good look at our health system has arisen. And we want to look at it in the entirety, from the beginning, from the bottom, that's the primary healthcare, right up to tertiary healthcare, and up to research, as you mentioned, as you also asked just now. So how to revamp the entire health system, not to do piecemeal repairs here and there that don't actually contribute systematically to improving the entire structure and the outcomes. So it's an opportunity. We're working very hard on it to see how the best opportunities can be used to reshape the health system.
Absolutely. Well, this is a good place to leave the conversation. Dr. Osagie Ehanire, Minister of Health, thank you so much for joining me tonight on NewsNight Nigeria. And of course, I'll see you tomorrow at the Presidential Task Force briefing.
Thank you. Thank you for inviting me.